Good morning, everyone. Thank you so much for joining us. Before we get started, just a little bit of housekeeping. So we are streaming today's discussion for CVS Health live on Facebook. So if everyone can just take a minute to make sure that your phones are silenced, but you can still chat during today's discussion. So hashtag Healthier Happens Together. We ask that you just tag that. Okay, so today we're really excited. Thank you for joining us on International Day of the Girl for an exclusive discussion on CVS Health's bold actions to help protect period parity. We're honored that you're joining us to help spark a dialogue around such an important issue that affects so many women and girls today. We believe that education and collaborative conversation is the first step to bringing awareness to this challenge that affects so many people when it comes to their period. So as many of you know, CVS Health has a long history of taking bold steps when it comes to health of its customers, and we are committed to doing everything that we can to make sure that our services and offerings are more accessible and equitable for all communities. I would like to have a warm welcome for our panelists today that you'll meet in a few moments, Dr. Joanne Armstrong, Asia and Layla Brown, Jake White, and Lynette Khalfani-Cox. Now, it is my pleasure to introduce you to today's moderator, Adrienne Byron-Houghton. She's known for her ability to lead candid and authentic conversations, and not only does she have a history of encouraging others to speak about their menstrual health challenges, but she's been vocal about her own experiences. We could not be more excited to invite you today, Adrienne. Thank you so much.
Thank you, Yannick, for such a great intro. Yes, we've been vocal about our periods, and we're excited for this conversation and the panelists that are here. Thank you so much for being here. We're gonna welcome right now Dr. Joanne Armstrong, Vice President and Chief Medical Officer for CVS Health. Yes. We have with us Asia and Layla Brown, co-founders of 601 for Period Equity, a grassroots organization based in Mississippi. Yes, doing great things. Lynette Khalfani-Cox, personal finance expert and New York Times best-selling author. We also have with us Jake White, Vice President of Consumer Healthcare, Pricing and Analytics, Front Store Merchandising for CVS Health. Thank you all for being here. Are we ready to have this conversation? Yeah. I am so excited. Like Yannick said, I've been very vocal about the fact that hello, why is it taking so long for us to be comfortable and normalize conversations about our periods, right? Well, today's the day. Happy International Girls' Day. Hello. Day of the Girl. Now, while menstruation and periods are becoming more talked about, there are still so many hidden costs and inequalities for many. And that's what we're gonna jump into today. That's what we're gonna discuss. We're gonna discuss pretty much the impact of period poverty and the bold actions that CVS Health is taking. Bravo, CVS Health, for that. To provide women an access to affordable, accessible healthcare services. And before we dive in, I think it's really important that we make sure that this is a safe and inclusive discussion for everyone. We recognize that not all people who have their periods identify as her, and that not everyone that identifies as her menstruates. So I think that it's important that we support all communities and that wherever you fall, we got your back, yeah? Yeah, let's go. Okay, let's kick it off with some stats. 64% of individuals have never heard the term period poverty. So let's keep it real right now. How many of you, before today, or before finding out about today, knew what period poverty was? Don't be ashamed. You knew? And a lot of you guys didn't. So see, this is why we're having these conversations. 42% didn't even know that they were putting sales tax on period products. So I really wanted to kick this off with you, Dr. Armstrong. Tell us, what is CVS committing to, and how does that fall? Where does period poverty fall in line with that?
Well, first, great to be here on the International Day of the Girl.
Yes.
Okay. So just sort of to kick it off, as part of CVS Health's focus on holistic women's health, we're addressing period poverty. And it's a really important equity issue that's really underappreciated in this country. And period poverty really influences the way that girls and women and others show up in life, you know, how we work, the social environments that we move around in, and it has health consequences as well that are underappreciated. So just to kind of keep it real,
Yes.
periods are real, right? They happen every month for 40 years of a woman's life. That's a long time, about 3,500 days, 10 whole years. And while it is normal and it's healthy, it is highly stigmatized. In fact, it is one of the most stigmatized conditions for women. About 60% of women and girls say that they are embarrassed, humiliated about having periods, talking about it, entering spaces where it's happened. And that influences how they show up in all these other places.
Absolutely.
So there's a lot of stigma, and then for individuals who menstruate and can't afford menstrual products, that's what period poverty is, that stigma is amplified even further. And it's quite common. 1 out of 5 people say that they can't afford period products.
And that cues me to Asia and Layla. From all the work that you do, can you tell us just more about who's affected by period poverty? And I love that you guys are speaking up about this and, like she just said, keeping it so real, which I absolutely love.
Thank you. That's a great question. So we're both from a small rural town in Mississippi. And so Mississippi is very in the forefront when it comes to the issue of period poverty. Mississippi has one of the highest luxury sales tax on period products in the nation at 7%, despite the fact that period products are a necessity, not a luxury. So definitely the folks that we serve, especially Black and marginalized folks, those who are imprisoned, those who are poor, those who are gender expansive, as we've discussed before, are at the forefront of this issue a lot of the times because there's a lack of education there, there's a lack of adequate, accessible products and, socioeconomic conditions that make it a real barrier.
Absolutely.
For those communities. So we do serve Mississippi solely, but we want to acknowledge that period poverty is a pervasive issue that affects those across the nation, across communities, cultures, backgrounds. And so, the current landscape with COVID-19 and inflation has only further exacerbated the issue in a way that makes it really hard for menstruators to get by on a day-to-day basis.
Yeah.
So we work to, dignify people and educate people so that they can, have a good day, still function as they normally do when they're menstruating because as Dr. Armstrong said, it's a normal bodily function. We go through it so much of life doing it, so we need to start having those conversations for sure.
I love that. Lynette, I'm looking at you next because as a financial expert, what do you think about this? Because even when she was saying 7% right now, I was like, when I think, and you mentioned 40 years, and some people even ends up being longer than that, I'm going to be 39 next week, and I'm like, how much have I spent throughout my lifetime, and how does this affect my finances? So what do you have to add to this?
Well, certainly when you think about the idea of period poverty affecting, as Dr. Armstrong said, 1 in 5 girls and women who can't afford access to basic hygiene services or products like tampons, pads, etc. That keeps them out of school, that keeps them out of the workforce, that affects their ability to fully participate economically in society. And so that's a real issue because we're talking about a huge number of low income, low wealth, financially vulnerable populations where they're not able to do the normal things that you would think to in terms of showing up. And if you think about it further, think about since today is the International Day of the Girl, think about the student who misses school, for example, because she doesn't have pads or tampons to wear during her menstrual cycle.
Yeah. And that adds shame, and you're just like, okay, well, I can't show up the way I would like to, or in general.
Exactly, but it's also disadvantaging her and her potential future because there's this spiral effect that happens, right? Absolutely. Where if you can't go to school, perhaps you don't have the same grades, maybe you don't get the scholarship, then maybe you don't get the job. And so it has this spiral effect. So we need to recognize that this is a very real issue, a very personal issue, but one with financial and economic ramifications as well.
Absolutely. So this takes us to Jake. She said 42% didn't even know that, like we mentioned, that 42% didn't even know that there was tax on period products. What is menstrual tax?
Yeah, so in 26 states in the US, period products are actually determined to be non-essential and are therefore subject to a menstrual tax. Isn't that incredible?
Wow. I was part of the 42. I didn't even think about it in that way. And that's why these conversations are so important, because when you think about that, you're like, wait, they don't consider this necessary? So I'm taxed on this? And over time, you recognize the repercussions of that. Absolutely. All right, so I have a question for Asia and Layla. Actually, I'm gonna throw this one to Asia because Layla answered the last one. What do you think about all of this, and just how can we help to get people involved and to help the communities that are suffering in this from period poverty?
Yeah, so like we've mentioned, the menstrual tax is just one of the many barriers to marginalized communities accessing these very essential products. They're not luxuries. We need them to survive and thrive, right? So with eliminating this tax and lowering the cost of these products, it makes them more accessible and more available to communities who need them, which I think is really incredible, and I'm really excited about what CVS Health is doing to kind of help fight period poverty in these communities. And I think for those of you who are in the audience or at home, I think it's important to know that we all have a part to play in making sure that menstrual equity is a reality for all, whether that's advocating for menstrual products to be available at your school or in your workplace, or doing a donation drive for your local shelter, or even a women's prison. That's something that Layla and I have done in the past. So I think we all have a role to play in this fight against period poverty, because it is a real issue that happens across the nation.
Layla, did you want to add to that?
I think she covered it, but like she said, we're both, young, and I think what a lot of people don't understand is that you can do it. It's not something that requires you to be a huge activist or anything like that. You don't have to have any prior education. You don't have to have a degree. You can do it. If you're, I'm only 17 years old. I'm a senior in high school. So it's possible for people my age, people, so young, to do things that they think matter. So I think that's very important to know.
Yeah. Speaking of tax, I'm going to go to you, Lynette, because I realize that there is a difference between menstrual tax and pink tax. Can you kind of explain what the difference is, and what is the financial burden that it causes to women?
Sure. So as Jake mentioned, the menstrual tax refers to the fact that more than 24 states tax products like tampons and pads. They don't consider them as necessities.
Yeah.
We hope to change that, of course.
Yes.
But the pink tax is actually not a tax per se.
Okay.
It's really more a form of gender-based pricing that is discriminatory, frankly, towards women. Because what the pink tax does is it imposes higher costs, higher charges, surcharges, if you will, higher prices for thousands of goods that are marketed towards women, but they're the same exact things that men use. So it could be razors, soaps, lotions, clothes, toys. You find consistently those things that are marketed toward us have a higher price tag associated with them.
That's crazy
And so,
when you think about it.
over a lifetime, we're spending kind of like a small fortune on, because we paid higher prices for these things over time.
Yeah, we need to make that change for sure. Jake, as part of CVS Health's announcement, they have committed to taking a stance on the pink tax, which I absolutely love, which is incredible. Can you tell us more about it?
Yeah, absolutely.
What is the stance?
Yeah, so we've actually got a ton of, we're a mission-driven company. We've got a ton of passionate colleagues that have been, for years working on this issue and trying to keep this parity between men's and women's products. And it's a real challenge.
Absolutely.
And so while we've been actively, taking action for a number of years on this, we've actually installed formal processes and made actual systemic changes, which is a big deal for a company our size, in the way that we can actually monitor and evaluate all these different products as they're added to the shelves of CVS stores. So, yeah, we're ready to take action, and we're going to constantly review the products that we carry to make sure that they're equitably priced.
I think that's absolutely incredible. That is absolutely amazing. So that takes us to equity. I think you kind of explained that perfectly. And now, Dr. Armstrong, overall, what is your perspective on equitable health? I know you mentioned that in the beginning, that that's really what CVS Health is committed to. And why do you think that these issues are specifically a problem for women?
So health equity is a major focus for our company and has been for a long time. But just to level set, what does health equity actually mean?
Yeah.
It means that every individual has a just and fair chance to attain their optimal health, unencumbered by other factors that are unrelated to their health. And those other factors include gender bias, racial bias, societal biases, just like how hard is it to get health care when you're taking care of your kids and your parents, and there's COVID, and you get paid less than somebody else. So when you think about women in this issue, in the question of health equity, you have to address both their health factors and the societal factors. And some of the health factors that we have are different physiology, right? Menstrual health is what we're talking about, but it relates to pregnancy and infertility and menopause. Highly, highly stigmatized conditions that we don't talk about. And then in a societal frame, women have much more challenges accessing care, making it convenient, easy, accessible. COVID has just blown that out of the water. But like, for example, 30% of women say that they have problems getting something as simple as birth control pills. 2/3 of the caregivers out there are women, which means that that's the amount of time that we don't have for ourselves. So all of our solutions really have to focus on the medical part and the societal part. And part of the societal part is how we tax women, right? What these extra unnecessary burdens are for women as they just try to, receive health care.
Absolutely. And that's why conversations like this are so important, that we really do, like you said, destigmatize periods, that we make these conversations normalized, not just amongst women either, but also encouraging and educating men so that they understand what's going on as well. I also want to talk to Layla and Asia specifically about their generation and what we're doing to truly make changes so that this next generation doesn't feel either the shame, the embarrassment, just like, I don't want to talk about this, and how that affects them in life. How do you think that this next generation is handling all of this and what they're thinking about when all of this, equity, pink tax, period poverty? What are you guys thinking?
I think that sometimes the younger generation doesn't think as much about it because they don't know about it. So obviously it's kind of left to menstruating people to deal with it, to carry the burden of the shame and the stigma.
Yeah.
And so in school, when we're interacting and there's a time when you have to deal with it yourself as a menstruating person, you're kind of told to just keep it to yourself, not discuss it. So I think the problem is that we also don't have that education in school so that it's taken to everybody, not even just menstruating people, because we're empowered by education, so we need to know about our own bodies, but other people need to know too so they know how to interact with us while we're menstruating, so they're sensitive to that. I feel like a lot of women and menstruating people have stories where they've been teased or where they've been embarrassed to go to the bathroom with a visible, pad or tampon in their hand. Like, I feel like we all have a middle school story where we're scared or embarrassed.
We've seen full-on commercials on TV that it was about how much smaller they could make it so that it could be trendy. Is that a piece of candy? Do you guys remember those commercials? It was like, oh, hide it, put it in your sleeve. I'm just gonna walk over there ever so. Like, it's a very real thing. And I think even on The Real, when we would talk about women's issues, I was super vocal specifically about periods because sometimes that was held against us. If people, the number one thing that is the most offensive thing you can say to a woman, especially if she's sensitive or whatever, oh, is it that time of the month? And how that was thrown around to women to be like the ultimate insult, especially in the workplace. Oh, she must be on her period. And we're really trying to change that stigma just in general, because that does affect how people show up in the workplace, how people don't feel embarrassed anymore. It's so important.
It is, and I think a great way to combat that, especially for young people, because we know how important social media has become,
Yes.
and young people's social movements. I think social media can play an amazing role and be a great tool for mobilizing young people about the issue.
Yeah.
So a lot of the awareness work that we do for 601 Period Equity is on our Instagram. We do a lot of social media posts, fun graphics that catch our communities and our peers' attention so they can learn more and, have more conversations, spark conversations in comment sections and DMs. And so we can, spark the dialogue that we need to have to normalize this. And so 78% of menstruating people actually believe that, seeing positive period content on their social media, on their feeds, helps reduce that period stigma. So I think it's important that we post period positive content to mobilize the next generation.
I love that. I think that is absolutely so true. Social media has such a huge impact, especially on this next generation. So I am so excited to see that. If you guys are doing it, I can't wait to see what this next generation is going to be. We're going to be like, listen, we got our periods today, okay? That's what's going on. That's what's up. And that we feel, like the fact that, crazy enough, because I'm from an older generation, and them even saying that out loud in a setting like this for me feels like, girl, why'd you just say that? But I'm like, this is what we're here to talk about today. Dr. Armstrong, please tell us what CVS Health is doing in the community and how they are really, really supporting women's well-being.
Yeah, I would start by saying we've already framed it, right? There are physical things that affect how we receive health care, that affect our health, and then there are all these societal things, and we are leaning into both of them. So at a policy level, we are leaning into period equity, talking about it. We can talk about this, like 40 years of menstruation.
Tell me that, because even when it came out of my mouth for a second, my old way of thinking jumped in. We can talk about this.
We can talk about it, and we have to do something about it. So the things that we are doing about it, Jake talked about, it's really addressing taxes on periods. So our company will be paying the tax in the states where we are able to do that. There are 12 of those. We are also reducing the price of all our store brand period products by 25%. Also looking at other women's health products that we can do the same in. We've talked about gender-based pricing and eliminating that, a commitment that a pink razor is the same as a blue razor. And then the other thing, just in a healthcare setting, to really lean into the things that women need to get health when they need it. So we're really leaning into addressing convenience, access through a virtual care footprint. We just a few weeks ago launched virtual contraception prescribing that makes it available really within a short number of hours, 48 states, plus the District of Columbia. It's important because 30% of women say, I have a hard time accessing this. So we're doing that. We're using our pharmacists prescribing where they can. There are about 10 states in the country where pharmacists can perform consults and dispense contraception. So we're looking at women's health holistically, and holistically means access, policy issues, other things that really drive inequities in care.
That's incredible. Lynette, Jake, how do you think that this is going to impact the industry when you have such a mass retailer like this spearheading this situation and saying, listen, we're going to take away the taxes, we're going to cut down the costs, we're going to bring that equality that we need? What do you think about this?
I think it's huge because not only is CVS Health taking a thought leadership position on this topic of period poverty, the pink tax, et cetera, but just from a basic standpoint of affecting consumers' wallets during a time of rising inflation, for them to say, oh, we'll pick up the tax in 12 different states for the menstrual tax.
It's incredible.
Or we'll drop our prices by 25% for pads and tampons and liners and the basic hygienic services that women need. That's huge.
Huge.
And so I think that a lot of people are going to absolutely I'll be up in CVS a lot more.
Exactly. Like that's the kind of store I want to
Just,
support. That's who I want to put my money towards that.
Listen.
I want to be able to buy a razor that costs the same amount as my husband's razor. I want that equality for sure.
And everybody is watching their dollars nowadays.
Yes.
Everybody is conscious about their spending. And so this is a way for them to align with the consumer. And frankly, what I like about it best is obviously, as Dr. Armstrong said, there's a health equity component to this, a huge health equity component, but it's also a financial equity component.
Yeah.
Because we've seen during the pandemic, and in recent years, we have so many gaps in this country. So there's a wealth gap, there's an income gap, et cetera. And we already know that women earn less money than men. By the time we get to retirement, we have 30% less money saved. And part of that is because we've been paying the pink tax for so many decades, you know? So I think this is an enormous step in the right direction. I'm super proud to partner with CVS Health on this initiative because it really is going to make both a health and a financial impact in communities all across the country.
Wow. Jake?
And I mean, one of the things I love about working for CVS Health is, we have a history of supporting women's health and also taking bold industry-leading actions to address, key health concerns. And so, if you talk about being the first to take out tobacco from all of our stores in 2014, we've challenged the beauty industry to remove photoshopped images because of the detrimental impact that can have on the mental health of women and girls. And, we've devoted the whole energy of our entire enterprise towards addressing the urgent needs, during the COVID-19 pandemic. We're a company that leads the way, and I love being a part of that. But, at the same time, we are one company within a much bigger industry.
Yeah.
And so, I would love to invite all of our peers in the industry, as well as our supplier partners, to follow our lead here, because we're ready for a change.
Yes, absolutely. Absolutely. I really do hope that this starts the change that we absolutely need and that there's a chain reaction that happens. I just want to go around the panel and ask, what does equitable health care mean to you? Let's start with Dr.
I think it's simple. I think everyone deserves the same fair the fair and just chance to attain their optimal health. It means that we should not have external factors that really are modifiable influence the outcomes that we achieve.
Asia, specifically to you, how does equitable health care for women affect you personally?
Yeah, I think for me and the work that Layla and I do with 601 for period equity and just trying to fight period poverty in our home state of Mississippi, I think equitable health care for women is a world where menstrual equity is just a reality. I don't think anybody should have to choose between, other essentials or groceries and buying, the pads they need for their family or for themselves that month. And so I think, that's what equitable healthcare means for me, for women, and just where women can have the resources and products they need to achieve optimal overall health as well as menstrual health.
Layla?
I think for me, it means, reproductive justice. I think it's important that we all have the resources and the ability to make choices that make our lives better. So I think what CVS Health is doing empowers us to be able to, go to school, go to work, and just interact with everyone just as, our male counterparts are given that chance. And I think that it's, really important that what we're doing is affecting people across the nation.
Lynette, even as a financial expert, how does equitable health care for women affect you personally?
Well, I look at health equity in a larger context, in a holistic context, because I do think that, as I mentioned earlier, there are a lot of gaps. There are a lot of ways in which we don't have equity in this country. Equitable access to higher education, equitable access to jobs, to pay, et cetera. And so I put it in a larger context and think about it as one of the ways in which we have to tackle a challenge to be able to provide better access. And again, I have a 16-year-old daughter, as well.
Yeah.
And I would be beyond thrilled if she was, doing the yeoman's work that they're doing.
Yes.
All of it is just showing, as they mentioned before, that we all have a role to play.
Yeah.
And that part of it is about raising awareness and about making sure that people understand, not just individuals, but organizations. And again, that's why I'm thrilled at what CVS Health is doing, that organizations understand that you can address some of these issues, because I don't like it when the individual is called upon to solve what is a systemic problem.
Yes.
You know, we
yes.
need structural, systemic solutions to these challenges, and that's what CVS Health is doing.
Incredible. Jake, what does it mean to you personally?
Yeah, these are sort of dinner table conversations about fairness and equality, in my family. My wife, my sister, my mom, they look at me and they're like, you're part of this, And so I am, inspired to be, at a company that's willing to address it. And I hope that, for my 5-year-old daughter, that we've made, incredible strides here, led by some of my co-panelists on, women's health equity issues by the time she's, aware of everything that's going on, so.
I love that. Speaking of Layla and Asia, just like Lynette said, I think any of us would be so proud if our kids were out there doing and making the changes that you guys are making and bringing awareness to something that is so, so important. We are so inspired by your work. And so today, Jake and Dr. Armstrong actually have a surprise for you. Take it away.
That's right. So we're super inspired.
They're like, hold up, wait a second.
I already told you that we're all super inspired. So
Surprise, surprise.
on behalf of everybody here, CVS Health is going to make a $20,000 donation in support of 601 for Period Equity's mission. So thank you guys so much for everything that you're doing.
You're gonna make me cry too.
Did he just say $20,000?
Yes.
Okay. So I gotta come back to reality, okay.
So very well deserved.
Absolutely, absolutely. You guys are emotional right now. You're gonna make me emotional. What does this mean to you, and why is this so important? Getting this kind of.
I think for me, I don't know, like being from Mississippi, we're from a small town. I feel like a lot of times we're counted out. We don't have the same resources, and we know people back home don't have the same resources as people in other states. We're from the deep South, y'all know what people say about the South. So, I don't know, I'm thinking about the people back home that we serve. I'm thinking about the women who text us periodically and say, hey, we really need some products, can you swing by? And I think just about what this means for them and for us to be so young. Layla's 17. I know I don't look 21, but I'm 21. And I don't know, just to be here with all of you, to even be invited, I just feel so honored and so blessed. So I just cannot express my gratitude enough to CVS Health, and just, I don't know. That didn't sound eloquent, but I'm
No, it sounded real. It sounded real, and we're so grateful for the work that you guys are doing. Layla, what did you have to say?
I'm at a loss for words, but I think just what Asia said, I didn't even think, I'm just shocked that we were invited, and he just said he's donating $20,000, so y'all have to give me a minute.
Just hearing you guys talk about how passionate you are about this, how did you even get into menstrual advocacy? I'm so curious.
Okay, so we started in the summer of 2020 because Asia was back at home, and so we were looking for ways to get involved in, women's reproductive health activism in general. So I joined a couple organizations, and she joined a couple, but we both joined as student ambassadors for the PAD Project, which is a nonprofit that's also youth-based. And so as student ambassadors, we learned more about period poverty and menstrual equity and what that means to us. And we saw that in the mainstream movement, it was heavily white, so we didn't see ourselves represented enough. So we came to them with a project, and we launched a social media campaign during Black History Month that centered the voices of Black menstruating people in the present and throughout history. And so that was very meaningful work that we did, and so that was that made us happy. And so we saw how important it was, and we decided to bring that to our home home state.
Yeah.
And so the rest is history, and now we're here. So
And you just got $20,000 from CVS Health. Come through. That is incredible. Lynette, I love how they're just being so, like she said, she's like, it's not eloquent, but we get it, we understand it. How can you better help us understand pink tax? Like, what are some of the things that, like, because you can hear that and just go, okay, yeah, until you hear the products and you're like, wait, I use that, I bought that, I just bought that yesterday. What are some of the products that are most highly taxed when it comes to pink tax?
Right. So I think one of the most common things where we see the pink tax is just a simple razor. So if you like go into the store, you find a pink razor for women, it's going to be more than the guy's razor.
Yeah.
That's something. But everything, toys, clothes, haircuts. Ladies,
Boys'
come on.
toys cost less than girls' toys.
Absolutely. Absolutely.
That is why
Then
when you just
haircuts, ladies, you know how much we pay for our haircuts.
This
you
is
know?
true.
So it's a slew, it's thousands of products and services. And so again, over time, you think about decades worth of us paying higher prices or surcharges for kind of the same things.
Yeah.
And it really does have a big financial impact.
Wow. So guys, I have loved this conversation. Is there anything that anyone else wants to add? Just that you feel, Dr. Armstrong, is there anything that you're...
I just want to say, I think the country is in really good hands with these kind of
Yes.
I agree.
Absolutely.
I agree. With that being said, I would love to know what is next for 601? 601.
Well, we just got $20,000. I think we really just want to expand and like continue the work that we're doing. We want to reach even more people in our state and beyond, because as Layla stated earlier today, this is an issue that doesn't just impact where we live, but it impacts everybody in the nation, every state. So we would just love to continue to grow, expand our outreach efforts, and I think also like get into menstrual health education. That's something that we're both really passionate about. You know, in Mississippi, we didn't really learn about any form of women's health or menstrual health education in schools. So we think it's really important that young girls and women know what's going on with their bodies, because with education leads to empowerment. And
Absolutely.
you feel more comfortable and knowledgeable about yourself. So yeah, I think, I don't know, the sky's the limit. So.
I'm looking at myself and I'm like, what can I do to help? Like, for each and every one of us leaving here today, what is something we can do to help bring awareness and advocate for menstrual, like what can we be doing to help?
I think talk about it. I think that's one of the, central things. If you have friends, if you have, followers on Instagram, do an Instagram live and, talk about your experiences. I think talking about things is, the best way to get things done and to get people educated about issues. Definitely, like Asia said earlier, you can, do a drive. You can donate to homeless shelters and prison populations.
That's great.
It's just anything you can think of that you can do. People are so creative these days and, and innovative. So I think there's so many things that you can do. Just, do you?
I love that. Well, Lynette, you wanted to add something?
Sure, and these are big issues. I mean, these are weighty topics.
Yeah.
And to a large extent, there's a lot of social determinants of health, right? And some of it is tied to where people live, the type of jobs that they have, et cetera. And so I think as we're thinking about what we can do in terms of raising awareness, even just studying up, even just reading up. You started the conversation by saying, how many people had heard of the term period poverty.
We had
It was
like four folks in here. Okay.
Yeah, it was like only a handful of people.
We're walking out very knowledgeable.
Yeah, exactly.
But there's still so much more we could learn, right?
Right. So as you educate yourself, each one teach one. Just share the message, talk to others, destigmatize, and also, again, bring everybody into the fold. Men, women, menstruating people, people who don't menstruate, etc. Let's make this, a rallying cry, one where we can all start to bring about health equity and financial equity in a way that has meaningful impact.
I love that. Thank you all for joining us for such a powerful conversation, especially on today, International Day of the Girl. We are definitely healthier, happens together. I absolutely love the hashtag. Healthier happens together. We can use that. And again, to continue this conversation, thank you guys so much. Thank you. Thank you.